So please run to, not run from, because I am having a healthcare badge.
I'm diving in so deep. Far from shallows. Baby, I'm all about heads. Blinded by headlights. Running in headlights. Light me up, headlights. Baby, I'm
Again, what to do with 1, 2.
headlights. Baby, I'm all about headlights. Headlights.
Medical emergencies management. Dr. Salim, الكراش كارد ready مش كده؟ 2 days ago I was in IKEA and I have with my family and I had a real emergency. A baby toddler, 6-7 years, 4 years maybe, and he crashed his head and he went for a brain concussion. The emergency, it is not listed here, but it's called brain concussion. Nurses, Julie, what is brain concussion?
It's like the brain.
It's yes. It's too much trauma and it's the brain a little bit moved inside the skull, so it provoke vomiting and of course pain and loss of sight for a while. Anyhow, it's mostly an ABC just to clean the vomit and to go for the expiration. And sadly, no one was oriented in IKEA. They lost their way and of course managed the trauma with ice packs, and of course we have to go for a hospital for 24 hours to avoid any bleeding. So again, back to here, I wish that my facility will be prepared and I'm gonna take it. I left you for 2. I'm reminding you that the story of 2 dentists and the medical emergencies is all I don't have to go for. Okay, the medical emergencies are 3 mostly, or the emergency management, or for my, it's this is to write please. Management of emergencies, management or emergencies in dental office. Emergencies in dental office are number 1, medical. Please write this. Number 1, medical. This is not the topic, this is a side topic. What are you doing? Okay. Number 2, first accidents. Number 3, spills. This camera is the correct position, yeah, Peter? Yes, you are. Okay. So these are, of course, the time will not allow for going, but for every topic. But please, this is a lifetime lesson, especially for doctors, females.
Did they do well with you, Dr. Nasser?
Yes, she was my team member 2, in which we have to, what is team member 1, what is team leader, what is team member 1, what is team member 2, and even they did not, the logistic part, they did not, the IKEA team did not do their phone calls.
From when I got
Team number 3. They failed to be team number 3.
And they did not even work as team number 3, and
they were not able to give me ice. You know,
Miss Heba went inside the kitchen.
Not kitchen, the
Kitchen?
Pepsi machine.
Okay.
Pepsi machine.
طيب. Back to our story. Yes, it took some training for Miss Heba to speak that confidently.
Dr. Hussien.
That's why this is a problem. Important things to reset. It's a mind reset. and this is mostly the problem. As a healthcare worker, till you are resigned from here or being kicked out, whatever, you are a healthcare worker. Yes, Algin, you are working in a healthcare worker. You're having a badge of healthcare, so they will run to you. They will run to you. So four things, ya Mariam, four things, they should be in your mind, ya Jessica. Number one, please, when there is an emergency, you have to ask himself, where I'm working in a healthcare facility. So, sorry for you ladies, you have to run to, not the common sense, to run from. So please, I know that this is something I'm gonna take one slide for it. Please, you're not gonna infected by death. And this is, by the way, I did the statistics today. 3 patients every 1 million visits. 3 patients out of 1 million visits. If I start dentistry for 40 years, I will meet 300,000 patients. I'm talking about myself working for 30 to 40 years. So if there is emergency, you're not gonna die, and mostly he's not gonna die unless you are part of it. Okay? So please, run to, not run from, because I am having a healthcare badge. Only run to. Number 2, start with the ABC. The topic to discuss ABC is not the topic of this lecture. A goes for airway, B goes breathing, C goes for. So before understanding anything, yeah, we start with a story of yesterday or 2 days before. Trendelving position, the vomit, kick the vomit outside. Okay, there is airway. There is breathing. Yes, there is breathing. Circulation, of course, by taking the pulse rate. Number 3, it's now to try to sort out what is the emergencies, and if it is out of these 6 emergencies, you are okay to leave. So there is 6 emergencies. I'm not gonna explain them now. There is 6 emergencies. You have to sort. This is A or B or C or D or E or whatever. If it is within these 6, I am in. I took this lecture. I cannot run away. And then number 4, reach medications, because most of the emergencies need urgent medications. So these are the medical emergency. Please, this is the main thing. Before telling you what is the name of this drug, how to use that drug, I saw it a lot. And I was working in traumatology unit, so I know how genius professors, arrogant professors, they wet their pants. Sorry, I saw it. So please, number 1, you run to the event. It's just number 2, check if there is airway, if there is breathing, whatever. This is what? Not yet. This is what? It's gonna be a number 3. And number 4 will be, of course, there is some sort of medicines that you have to search or ask for. With my 32 years experience in healthcare, you do like this. You can YouTube it. You see emergency, you see lots of zombie movies, so you usually, and sadly, you run away from emergency. Why? Let's try to figure it out and try to not do it. I'm doing, as the last lecture, I'm only responsible for 20% of your misery. But this is based on how to run from. It's based on your designs, internal design and desires. For my opinion, this is the most important slide. Why we run away? Because you don't want to be harmed or don't die now. You think that this emergency, this seizure, this angina, this death is coming and you're gonna die. So you run away from it by your nature. Fight, flight technique. It's sadly, it's in our instinct. Please rest assured, rest assured. It might happen, there is no warranty, but it's 2 out of 1 million. I did my researches. And for the genius dentists, for working 40 years, he can maximum see 200 to 300,000 patients. So please, emergency is not a zombie. And now, and number 2, I am in the health care, so I shouldn't follow the rational feeling of life. Sadly, and it is being attached to Indian nationalities without racism, running may be understandable. Peeping Tom is not accepted, and sadly, it is done usually with the running. You know what's peeping Tom? Yeah, there is an accident. Yeah, oh, yeah, blood. Yeah. Okay, if you cannot help, just go. So please, these 2 instant natures in your design, please, there are no place for them here. Okay? So, yes, I will take, and I saw it many times, this is the most crucial slide in this presentation. Try to fight yourself, not to emergency, I will fly. Please, no need, you have to fight to fly into. And if you have to fly, no, if you have, okay, I will accept your power, your internal design. No need to be the smart, the other guy, stupid guy, to just look and check what is going on. Number 2, okay, خلاص, I will agree, I will not fly, but I will not go in. I cannot remember the lecture, so my image as a maxillofacial surgeon, and I will look clumsy, I will look not good, and this is mostly happens in hospitals. When you're being trained not to fly, but you also don't go because Jessica will be embarrassed in front of Rachel, or Ashraf will be looked dumb, but Ashraf, he's hospital graduates. How many weeks you have been in the hospital? 3 months, 2 months, 3 months? 3 months. So of course he knows some medicine things. He will not have to fly, but he might be embarrassed that, oh, I will not look good. So the social embarrassments some might prevent you from helping. Number 3, okay, I didn't see it before and I don't know what we do. This is my lecture will start. But if we start what to do this and do that with emergency, come on. I know that the lecturer is the first one. I know it by heart. And the lecturer is the first one to fly. And I'm talking about the most common, the 60% of faintings. Faintings, it happened. Fainting. See, the fly, everyone is. And happened like boof. So don't do this, please. Right? Anyhow. Okay, might be painful, might be not the everyday practice. I don't know, if you can see the cat chasing laser, you can see some emergency in the YouTube also. It will make you familiar when you see it. You will not feel that. Yeah, sometimes fainting is very harsh. The trauma from the fall is more aggressive than the cause of the fainting. So these are the 3 things, and these are the crucial things. And sadly, I don't know if anyone knows this this left brain versus right brain. It is emergency. It pushes directly in your right brain, in your feeling. So please try to resist this intimidation. Definitely, management with emergency is not a right brain decision. It is a left brain. Who knows? You know what is right brain, left brain thing? Left brain is responsible, left side of the brain is responsible for left brain, okay, on the decision making. Left brain of left side of the brain, I know it's responsible for the movement of the right side.
Actions.
Left brain, left side of the brain is responsible for nope. Analysis. It's responsible for analysis. The left side of the brain is responsible for your analysis. Okay? The right,
So,
it's not the heart
yes,
side for lovers and Valentino thing. The right side of the brain is responsible for emotions. Okay? So, the gush of seeing emergency, I know that I'm not gonna go in details for the emergency. See, I will give it you in the PowerPoint and inside the exam. But crucial, this is what I'm talking about. So please, when you see emergency, don't move with the right side. You have to be a little bit rational, and this is one for men and double for women. طيب, let's go in business. What is the most important and most common emergencies that we have to deal? My colleagues in the last 2 weeks, they went for medical emergencies, but not well standardized as a dental office. You search it for the wrong title. We are talking about medical emergencies in dental clinic. Medical emergencies in dental clinic, it's being average of 6 or a little bit more, starting with the arrest. It's very rare, but it's very important. So, importance, not because it's common, importance because it is severe, but sadly it is not in our scope of the lecture. There is a BLS courses. Doctors are required for ACLAS, and this was our mistake. My SOP, doctors will go for the advanced cardiac life support. The others will go for the basic life support. Yeah, mine is expired. No, if I have a BLS, no need to have a ACLS.
We did it anyway together. Yeah. We did both.
Yes, if you have ACLS, because they are telling me that I have to go for the BLS. If a doctor licensed with ACLS, there is no need. If someone is liable to drive a truck, it's called grade 2nd degree, he can drive a car. So this is our mistake. I don't have to go for a BLS if my ACLS, any doctor, is valid. Any doctor. So I think it takes 1 year more. Yeah. So this is our bad. So the license should be in the MySmile BLS/ACLS. I was talking about the cardiac arrest, and of course, all nurses should have. You have your BLS. All nurses and selected staff, front office, and one each office. And in the back end, the whole area of carpets, the admin, I should have 1 or 2. So if you want to make your name with Ronald, you are most welcome. So what is our limitation? All nurses, selected staff from the front office, selected staff from the back office. At least 1. Back office, I need at least 1. What I prefer back office, the area of the HR and the SQE and stuff. Okay? So anyhow, the cardiac arrest is not the topic. I'll start with angina and its bigger brother, which is infarction. Then anaphylaxis and some younger sisters and siblings, we call it other allergies. We go for asthma, and some siblings. We call it other respiratory stresses or distress. I'll go for syncope, which is a very easy peasy thing, but why it is under emergencies? Why it is under emergencies? 50 dirhams. Why syncope? Loss of consciousness, although it is bullshit, it's nothing. Why it's under medical emergencies? You're silent?
Because if it's not managed, it may lead to morbidity or mortality.
Well, yes, but this is not the correct answer. Not the correct answer.
Fall can be more than
الفول no. No.
It will cause permanent damage or death.
Well, usually patient can go by himself, awake by himself. Okay, when we do classification, when you go for a philosophy or classification, you classify as per type and as per, this is the answer, frequency. So this is 60% in your life. If you have 20%, 20 patients, if you have Jessica with us 2-3 years, and if you see 2 or 3 patients with emergencies, if you see 3 patients with emergency, 2 of them will be syncope. So it is not because it's dangerous. Of course, it might go to blah 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 blah, but this is the main emergency that you can see. So it's here not because of its dangerousness. It is here because this is usually or mostly the only complication that you're gonna see. Okay, syncope, which is which is also is siblings of hypoglycemia and hyperventilation. When we say syncope, we refer to the vasovagal, the psychogenic, the syncope of fear. But sometimes it's from hypoglycemia, and sometimes the other way, hyperventilation. Then number 6, seizures and strokes. And I will discuss, but later, not to make you bored, why it's under emergencies for us. So this is the second topic that you have to write for me. The types of medical emergencies, or most important, most common emergencies. Right, this is... No, we are in the same. This is number 1, which is... This is example for what? This is doing what, this guy? CPR, which is cardio, pulmonary resuscitation, which is not the topic of our day. So please, if you want to sign, I'm offering on our expenses. If you want to sign, unless you resign, you're paid for us. If any staff want to apply for the BLS with us, I mean with a professional, because it should be certified by the American Heart Association, or for doctors to go for the ACLAS, or even the ATLAS. You know what is the ATLAS? As a maxillofacial surgeon, I took it. You owe me, I owe you 50 dirhams. Yes, it's advanced trauma life support. Where's Joey? Thank you, yes. But I will say, Joey, cut it to 50. Well done, yeah, Mariam. It's called advanced trauma life support. طيب, let's go for the angina and infarction. I don't want to go for blah 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 blah. 2 names. This is the shape that was one with angina. Long story short, this is the heart. Heart is a muscle. It needs blood. It takes blood from these small things, these small arteries. We call it coronary arteries. If these coronary arteries are narrow, so when my blood start to move, when my heart start to move, and there is no blood, this will be angina. But what happened? It is totally blocked. It will make death for a part of the heart, and we call it infarction. Simple as this. When you see some guy like this, it's cardiac problem, and our emergencies is to talk about two problems: angina or infarction, and this is the cause. And hypertension, smoking are participating factors. Stress, and of course dental stress, fear of pain, fear of anesthesia is something that we produces, so it is a provoking. No, I have to ask Arab guys. عمرك تعرف تنقذني؟ You know what is the difference between precipitating factor and provoking factor? I told you to go to TOEFL, صح? طب another Arab lady, Asma. طيب, this is Peter. أهلا بكم. حد غير عربي. آخذ حد مش نيرس. Jessica, what is okay? You are Native American. What is the meaning of precipitating factor and provoking factor?
Say you're precipitating is like you're like anticipating it will happen,
Okay.
and then provoking.
Oops. So it's my problem.
Provoking is
طيب رازيل, registered يا رازيل? Okay, tell us يا رازيل.
I think these precipitating factors is like
Causes of this or causes of that?
no, causes of the diseases like that.
Okay, I'm talking about this condition. Which goes here, which goes there. Well, I discovered that I'm overshooting. Dr. Ammar, can you enlighten us? What is precipitating, what is provoking?
Smoking and hypertension will cause the body to look like the picture on the right where the arteries are blocked. And
This is what causes the angina?
this will be there, and then when stress happens, excessive hypertension will lead to the closing of this completely. Will lead to that on the left.
So what is provoking?
Provoking is inducing.
عامل جانبي أو
It's triggering.
Triggering. Okay, sorry for using complex English. I thought that it's an Arabic thing, but I didn't manage. طيب, guys, this is not the angina, guys. This is not the angina. This is the precipitating factor of the angina. If he's in rest, he's okay. If you go for running, stairs, stress, this will make no blood, so pain will come. Angina is not this. Angina is when the guy with this has to go for more blood. Okay? Why I'm losing time here? Because sadly, if you don't know what is this, you will not know which drug to choose. So enough for this. Again, how to manage any medical emergency. What happens if you see a guy like this? Run to him. So please, the medical emergency is run to. Be sure before doing anything that this is air, there's breathing, there's circulation. Then now start to diagnose Then, okay, it is number 1 or it's number 2. So what is our medicine of choice? What is our medicine of choice? Oxygen is sub number 2 actually. What is number 1? Sublingual nitroglycerin. It's simply vasodilator. Algin, not to go for too much rocket science. Nitroglycerin, we have to make make this white. So whatever the plugs inside, it will be white. Of course, it will make headache, it will make another side effects, but it will serve, it will make our patient surviving. This was explained last time, correct? Right. So our medicines, we have 3 things: oxygen, sublingual nitrate, which is a spray, and aspirin if you go for the next level. What is the next level? If you give nitroglycerin spray, 2 spray, then another 2 sprays, should be within 5 minutes, the patient will be okay. If patient will not okay, this is sadly not narrowing. This will be block. So to avoid this block to go permanent clot, we have to go for aspirin. Then of course this case definitely to be hospitalized. Right, this is a brief summary. I'm not going in details, but angina, nitroglycerin. Angina, nitroglycerin. There's either tablets or spray. In our version, we use spray. Take care. If EpiPen, if you give EpiPen, that's why we did not start with anaphylaxis. This looks not good. If you misdiagnose, let's give him EpiPen. Rest assured you will kill him. So EpiPen or epinephrine, it's increased the cardiac output. So he's suffering from not having oxygen. So if you give EpiPen, I'm gonna see it, Dr. Salim will demonstrate, you will kill the patient. طيب, this is a very characteristic, and even my patient, but it was not in my clinic, 2 hours after my medications, this is the photos similar like this. Everyone know what is this? Allergy, and it's the severe form of allergy. It's called anaphylaxis. Anaphylaxis, it suffocates the patient. This swelling happens in the larynx. So he's actually will die from suffocation. Okay? So it is usually from medicines or foods, seashell, chocolates, eggs. So we have to take a history, and sadly it happens suddenly. And there is only one saving drug. Only one saving drug. If it happens, only one drug. You know what is it, Yamari? EpiPen. And shame on you, Yamari, that you don't know it. So I think I will make you one of the back in the office to go for the BLS. It's only one drug. That's why, yes, swear to God, you will really save his life by only this injection, which is the EpiPen, and to make it to control its EpiPen is giving him adrenaline. It's like giving battery to him, and of course it's illegal medicine. So to control the action of the EpiPen, we give very hard dose, very large dose of morphine. Same, but easier than this. Cortisone. Now what to do? Again, yeah, I know you want to. When you say this, I know that you want to run away. Please, again, the emergency is run to do ABC. Diagnose what this looks like. What? Angina? No, angina like this. It looks like anaphylaxis. So now start managing medicines. And as I said, epinephrine or EpiPen, which is 1 to 1,000. And there is another dose for kids, which is 0.5 to 1,000. And the hydrocortisone, very big doses. To tell you how big this dose is, when I do surgery and avoid swelling, I give 20 milligrams twice daily for 3 days. So the patient will feel like magic. So 20 twice, so I give patient for 3 days. On 3 days, I give him 120 milligrams. So in one shot, I administer 100 milligrams. It's actually like morphine. Then additional advances thing were antihistamine. We know all the name antihistamine. If it is the case is aggressive, to control the rashing and the allergies. So I'm taking the main 3 topics, the main 3 things. So go back to angina. We have 3 things to manage: oxygen, sublingual nitrate, aspirin if it goes deep. Here I go for another 3. This is just please, but this is for life. There's extra knowledge in the exam, but this to take you with you for life. For anaphylaxis, I go for EpiPen, epinephrine, hydrocortisone, and antihistamine. I reminded you it is, as you can see, arrest, angina, anaphylaxis, asthma, syncope, seizures. You can make it like 4 A's and 2 S's. I agree. When you go for diagnosis, run 2, make ABC, check which one of these. It's okay to leave. It's okay now to leave if it is not under your scope. Fracture, femur. Of course, you do. If there's bleeding, you will go for the ABC. But you don't have to do anything for fractured femur or fractured hands or lacerations of the scalp. It's okay not to manage, but this is as your part of your ethical obligation of healthcare provider. So which one is coming now? I finished this 3. Actually finished 2 because number 1 is not under our scope. Type asthma, it's kind of allergy, or it's kind of when you have a running nose, when you have itching, when you have cutting onion, okay, and you have a runny nose and a runny eyes. This is allergies having runny but not runny nose, not runny eyes. Runny bronchioles. For the allergic thing, allergic reaction, which might be pollens, seeds, dust, unknown, and suddenly it comes by attack. Sadly, it comes by attack. So, as if the patient is suffocated in his sputum. This is as simple as what is asthma is. Allergy. Suddenly you have a running nose, running eye. Sadly, he has in the attack. When the attack is provoked, he has a running. So technically, he is dying from, if he will die from asphyxia. Asphyxia means as if he's drowned. Definitely, it's with a childhood history. So that's again our triage in which you make it blah 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 blah. It's time for us to do it properly. And sometimes it's provoked by stresses, medications or stresses. Again, what to do with run. 2. Number 2, ABC. Of course, here you should go for oxygen. Sometimes in severe cases, but this is on the advanced trauma life support. We have to go for laryngectomy. It's of course it's not. Some movies show you how to make it with a pen, how to make it with a kitchen knife, but it, of course it's not your scope. So emergencies, run to ABC, diagnose and manage and medicate. And our hero here is the inhaler, and the inhaler Ventolin, but the name is
Salbutamol.
salbutamol. And you have history of asthma.
I don't know.
Salbutamol, of course, is our hero here. Without it, you cannot move. Of course, oxygenation, and if it is too aggressive, you have to go also for hydrocortisone. I have to run fast. Okay, number 5. Yes, it might go fatal, but it is here not because it's fatal. It is here because it is very common, and you have to differentiate between the fear-related one, in which there is no enough blood to the brain. So please don't do this, and I saw it many times in accidents. I saw it myself, and I have to shout out loud to kick the peeping Tom. A lady was crossing and not looking to the cars. Then I was just 2 meters away. So I saw it with my eyes. The car did not touch here. It was like half meter distance. So only with the sound, then when she start to, it's sound of psychogenic shock. So they try to, when she opens her eyes, they let her sit down. Then she goes down again. Then every time she just needs someone to let her sleep and do this for her leg. So how stupid? Yeah, of course, this is, if they left like this, she will go for stroke or brain damage or brain ischemia. So please, we do this in the chair, the dental chair. Okay, it's called zero position, and we can even, the nurse can elevate more. So please don't do this. And if it is related to uncontrolled diabetes or dental treatment without meals, you go for some sugary, in which that what provoked me to do this lecture. I have case like this, just simple hypoglycemia. I searched for my emergency drugs, and I did not find the drug. It's like epinephrine for them. It's only some juice. If it is too harsh, I'll go for glucagon. This is what we're gonna see now with Dr. Salim. And take care, yes, it will, if it is left untreated, it will go for brain damage, but this is not the case, mostly unless you have a very stupid healthcare staff, but this is expected to be common, and of course we try to prevent it. Number 6, which is stroke and seizures. It's for seizures, it's this shape of frothy saliva, blinking eyes, jerky movements. It's nothing to do, but why it's here? Why again it's here? Because it is provoking the run away. Let's see together. This is what you see. So it's just nothing. It's just electrical problems. But when you see this, sadly, you have to, as a human nature, you run away. This is, how many one saw a seizure attack before? 1, 2, still minority. So now don't say that I did not see it, okay? Now you saw it. You are not virgin anymore. Now you see it, yeah. This is what to do, it's usually nothing. What to do, it's usually nothing. But why it's under our, it's under our scope? Because it provoked the runaway for you. We don't do nothing. We have, of course, to move fast to lessen the damage. This is 100%. Again, it's the same. Why it's under emergencies? Because it makes the staff left brain stop working. That's it. We have nothing to do for seizures as healthcare providers. Nothing to do with the strokes. Hurry up, Doctor, please, within 5 minutes. This is the emergency drugs that being visited today, and doctor gonna show us one by one very fast.
Usually this is locked with a key that is connected to a zip. Okay, so when we remove this key, we have to create an IR. This is number one. I don't need this. So it has drawers, okay, and these drawers start with the most important, the emergency drugs, which when you open it, the first drugs here are most of what we have there, because these are the most important, starting with the EpiPen, okay?
Let them see, please. Let them see.
So,
Okay, and of course, by the way, this is it's not used for hospitality. This is a glucose for hypoglycemia. Okay, it's apple juice. Also, we have this sugary gel for also for hypoglycemia, and again for so we talked about anaphylaxis, which with anaphylaxis we use EpiPen, and then we use also the cortisone, right? This is the Solocortave.
Yes.
Okay, this is we give intramuscular.
Yes.
And what else? And antihistamine. We also talked about antihistamine, which is this chlorohistone. This is all same. Also, it's an injection. These are ampoules. It's ampoules for injection. Antihistamine. Okay. So this is the Ventolin for asthmatic. You've all seen it, the spray.
Let them see, please.
Okay. So we give about two to four sprays within 20 minutes. Yeah. And also
Aminophyllin.
aminophyllin, this one. It's an injection. This one. Okay. Okay. And for patients who go symptom because of hypoglycemia and fully unconscious, we can give this intravascular glycogen. This is for unconscious patients, okay? Because if they cannot swallow anything that you will give them. Also for the angina, what do you give for the angina?
Nitroglycerin.
Okay, so we have it as a spray. By the way, we have presentation, but for the first. Okay, so this is the one for angina spray. It's a spray.
but it will spray below the tongue. Not
Okay. What else do we, when the patient is having prolonged angina, which is a myocardial infarction, what do we give? Aspirin, okay. So how many milligrams? So this is 100, so you give 3 tablets.
300 supposed to be.
Yeah, so this is 100, 3 tablets. Okay. This is the list.
Put it in the other drawers.
Okay. This is the other second drawer is for the syringes and carriers and things that you need for the injections. And the third one we have for wound management, all types of bandages and these things. And in the third one, we have some medical devices, like a stethoscope, the one that the doctor checked the heart, and some eye lotion, okay, this is for eye emergency, and some sterile iPads, not iPads, iPads, yeah? Okay. Yeah. Okay. And then the last one is important. If you remember, we talked about spills. Anybody remember what type of spills?
Like chemical spells.
Okay, so mostly biohazard and chemical, right?
Yeah.
So this is our spill kits. This is biohazard. Okay. This is for urine. And this one is the chemical. It looks red. Chemical spill pack. Also, we have some IV fluids. We have ambu bags. And many things we have. This is when patient heart stop. You know, the one with the electric shock.
Yes.
So this is we call it AED, right? So this is one of the most important things here. So we keep it here on the top. So for facilitated use.
Thank you.
Of course. Thank you, doctor. Thank you.
So just one last thing. This is this is a reminder for the dosages, because you know when you're in a hurry, maybe you forget or something. So this is a reminder also.
Thank you. Sunday, 12 o'clock, there will be hands-on again with Dr. Salim, with the nurses or the medical staff. 12 to 1. 12 to 1. There's gonna be a hands-on training. This is an orientation. Thanks everyone, and hopefully this is gonna be a lifetime lesson. See you and Ramadan Mubarak.